Doctor Says 360. Smooth and joyful Pregnancy 360 is brought to you by KL Fertility Center to help you with your pregnancy journey.
Hi, I'm Dr. Natasha. I'm from KL Fertility Center and I'm a consultant obstetrician and gynecology with specializing in fertility.
Who is more suitable for IVF?
There are several reasons where a couple may be suitable to do an IVF, which is firstly, the female partner is advanced in age, such as we will take it maybe 40 and above, or she has bilateral blocked tubes. Other factors such as they have been trying to conceive for prolonged years. Sometimes maybe they come up to 10 years of trying to conceive. Then, we, instead of using simple methods, we may then opt to go to the more effective fertility treatments such as IVF. Some women will have been diagnosed with conditions such as endometriosis. Endometriosis is a condition where the lining of the uterus is outside the uterus. So when this happens, the inside where the peritoneal cavity, where there are the tubes and the ovaries, there are lots of scar tissue, lots of inflammation. So when this happens, this will reduce the woman's chances of conceiving naturally due to stuck ovaries or poor egg qualities, less number eggs, and also scarring of the tubes. So in these cases, it's probably better to do IVF for the couple. Other things, factors such as poor sperm count and quality, or the couple just been trying to conceive several times. Perhaps they have tried IUI treatment and they have failed several times, sometimes up to 3 times or 6 times of failed IUI. Then the next step will be to do an IVF treatment. Finally, some patients with unexplained infertility, whereby when they've done all the basic fertility investigation and unfortunately there is no reason found for them to be not pregnant. So this is what we call unexplained infertility, and they are also potential candidates for IVF.
How many couples are there who are currently undergoing IVF in Malaysia? What is the average age?
Unfortunately, in Malaysia, we do not have access to the exact statistics for information like this. But we do have information from local IVF market analysis who estimate that the IVF cycle done in Malaysia from 2017 to 2022 to be roughly about 22,000 plus cycles. So that will probably be about 4,000 cycles a year for Malaysia. So, however, we can compare this to the USA, where they do actually have a government body which monitors the number of cycles. This is called the CDC, Centers for Disease Control and Prevention, and they have reported a total of about roughly more than 300,000 IVF cycles in the year 2020. And from this, they had about 90,000 of pregnancy, about 80,000 of infants born. So if we were to look at the success rate, unfortunately we have to use that their statistics, and probably more or less it probably be about the same for Malaysian as well. So if we were looking at the age of the female age who has actually gone for IVF, roughly about 37% for women aged 35 and below, 25% 35 to 37, 20% 38 to 40 years old, and about less than 20% for more than 40 years old. So I think we're probably looking roughly at that sort of statistics as well in Malaysia.
A baby in a year of the dragon. Do you want a dragon baby? If you said yes, don't miss out on the Fertility Forum Ultimate Fertility Guide to Pregnancy prepared by KL Fertility Center, Malaysia's leading fertility center to help you prepare for a dragon baby. An experienced team of doctors will be there to share valuable pregnancy tips and information with you. They will answer all your doubts through interactions with you so you can start preparing for a dragon baby confidently. Visit klfertility.com for more information. Seats are limited, so register quickly now. KL Fertility Center wishes you a smooth and joyful pregnancy. What is the success rate?
A clinic's IVF success rate is the number of births reported divided by the number of IVF procedures which has been performed. Okay, so how many births reported over how many IVFs you've been done. So that is basically the success rate. But you will need to, each clinic probably will report it differently. So it's actually, if you are keen, you actually have to ask more detail. What do they mean by their success rate? Could be different or varying from between clinics. But overall, the main key factor when we talk about success rate will actually depend on the woman's age. So in general, it has been quite the same, but I'm quoting the US statistics because we do have their statistics. So in general, they are saying that for the women, if they're less than 35, success rate will be about roughly 50%. If she is 35 to 37, roughly about 37%, 38 to 40, about 23%, and more than 40 is about 7%. I think it's roughly the same statistics overall in a good clinic. If the woman is less than 30, success rate is about 60 to 70. And on overall range for our clinic in KL Fertility, 30 to 39 years old, we're looking at about 40 to 50%. Now, when we hit 40 years old, the success rate will decline sharply from one year to the next. So 40 to 41 drops significantly to 42, 43, 44, 45. So 40 we may be looking at about 27%. Once we hit 44, 45, it will drop much more significantly down to maybe 5%. More than 45, it's less than 1% of success rate or life take-home baby rate. So this is something very important. Sometimes in the community, people assume if you're still having regular menses that you are still fertile. I think that's not true. So when a patient or when a couple comes, we actually pay quite important, we will ask basically, one of the first few questions we'll ask is the woman's age. Right? I mean, that saying that the man's age is also important. There have been some research showing that the older father will probably produce an offspring which may have issues with autism, so some other defects. So older, what do they mean by older? Maybe we're looking at 50, 60 years old.
Dr. Says 360 specially invited KL Fertility Center to help you have a smooth and joyful pregnancy. Wishing you all the best.
If you like our channel, please like, share, and subscribe.